This is the Mechanical Care Forum, episode 401. It's season 13, and we're highlighting the McKenzie Institute International Diploma Program. Today, we're connecting with 4 other clinicians, previously diploma candidates, now diplomats. Post-exam, we'll hear how they felt approaching the exam, the highs and lows with the exam itself, their reflections on the entire process now that they've accomplished this achievement, and what they hope to do next going forward. This week on MCF. Hey everyone, welcome back. Thanks for joining us today as we continue to explore the McKenzie Institute International's Diploma Program for this season, season 13 of the podcast. This episode is brought to you by the McKenzie Institute International. The McKenzie method of mechanical diagnosis and therapy is globally recognized as a leading treatment for back, neck, and extremity disorders. Personally, MDT has made the single greatest positive influence on my practice, hands down. The McKenzie Institute International offers this diploma program to those professionals who have achieved prior certification in the method. It's the pinnacle of MDT training. Successfully completing the diploma program will place you amongst the world's elite in mechanical diagnosis and therapy. If you're interested in learning more, here are a couple of ways. First, stay tuned today and be sure to follow us all along through this season, season 13, as we highlight this year's cohort of students through the program and get perspectives from the CEO of the McKenzie Institute International, this year's candidates, as we hear from some of the instructors as well, and more. And second, be sure to go to the website to learn more about the program and how to apply. You'll find that by going to mckenzieinstitute.org and clicking on the Education tab and scrolling down to International Diploma. So you'll know if you've kept up with this season, season 13, that we've walked through from the initial 2 weeks of the program. We've heard from the CEO of the McKenzie Institute International and the director of the diploma program. We've welcomed a few theoretical portion instructors and clinical placement tutors, and checked in with a number of my peers through each of these 3 phases of the program. Today we'll shift, introducing Elizabeth Montler and inviting back Ray, Daniel, and Micah, all 4 who have successfully participated and passed the final exam just prior to this recording with myself. We'll touch in on how they felt going into the exam, the roller coaster of confidence and self-doubt in the exam itself, their view of the program as a whole now, where they hope to head professionally, and plenty more. And don't forget, we're sharing the full video episode on the YouTube channel if you're not listening to it there, which offers that visual element as well. So if you want to check that out, head over to Mechanical Care Forum on YouTube. Do stay with us through to the end to hear what's coming in future episodes. So here we go. Here is episode 401. Enjoy. All right, so with me today on the Mechanical Care Forum, I'm pleased to welcome back 3 gentlemen and finally some intelligence to the group. A new face, Elizabeth Montler. Elizabeth, Daniel, Micah, and Ray, thanks for joining me today.
Thank you.
Thank you.
So we're a little looser. We were just commenting before starting the recording because we've successfully passed the final exam, and we let our hair down a little bit. Some of us shaved our hair a little bit. So since the last time, if you're watching this on the YouTube version. But guys, thanks for joining me today. Congratulations first, you guys, on passing the exam, and kudos to us. We'll put a little cheer in the background.
Awesome.
I got you.
There you go. Nice work, Ray. Guys, I asked you to just do a little thinking on the process, on the prepping for the exam, on all of those things. We'll talk about those in a minute. For those that may have missed the previous episode, for you gentlemen, I'll ask you guys to mention briefly where you are and just your clinical setting, what you're doing and where you are. But let's let the ladies go first. So Elizabeth, why don't you tell us a little bit about yourself since you're new to the podcast? Where are you?
Yeah.
And what are you up to in terms of your clinical work?
So I'm in Central Vermont. I work for Central Vermont Medical Center at one of their outpatient clinics. And I've been practicing for probably 21 years. Yeah. And I feel like I started my MDT journey probably in 2018 with the first Part A.
All right. Thanks, Elizabeth, for mentioning a little bit about yourself. Daniel, why don't you go ahead and mention where you are and a little bit about your clinical work? Just remind the listeners.
I work in Durham, North Carolina. I work for a large physician-owned clinic. They've outpatient orthopedic. They merged, like 6 years ago. Been there 8 years. Started down the MDT journey about 2011, and I was certified 2014, and then have just kind of waited to try to go through the diploma portion for several years now.
Excellent. All right. Thanks for coming back. Micah?
Yeah, so Micah Sales, live in Athens, Georgia. Our clinic's located in Swanee, Georgia. It's about an hour away. Kind of started my MDT journey pretty much right out of school. It was in 2018. Fortunately or unfortunately, however you want to put it, got to work side by side with Gary Dykes. He kind of slowly introduced me to it. So, and then once I saw the responses we had with patients, and that I was hooked. So I knew and had to go through the whole process and truly understand it. And I've been thankful ever since.
Mm-hmm. Micah, you're in what setting again?
It's a outpatient orthopedic setting, but we see some little bit of neurovestibular. It's physical therapy and balance centers is what that is. So see a good little mix.
Okay, good. And Ray?
So cool. So yeah, this is Ray, and I'm located in New York City, and I work at a outpatient physical therapy practice attached to a hospital, and I also have a private practice I do online. And started my MDT journey in 2019, and just got hooked, seeing the rapid response in my patients, and decided to pursue the diploma shortly after.
October, November timeframe of when they offered the exam, we all were eligible to take that. And again, you guys were in that 2022 cohort that started the theoretical. My schedule, I started with 2023, but my clinical was quick and right after my theoretical portion, which then gave me the minimum of 2 months just outside of that to be able to take the exam with you guys. So I think, Micah, you were first a week or so later. Ray and I were, I think, about right the same week. And then you, Daniel, and then Elizabeth the week after Daniel, I guess. So, and the good thing, I already blew the cover, but we all passed. So, exactly. So I just wanted to kind of give listeners a sense. We could have had, one of us on that didn't pass, and that would have just been a real big drag. So we, that would be good. I wanted to make sure.
Let's ask more questions.
That's right. Yeah. So how does it feel to have not passed? But will you guys talk a little bit for a moment about your thoughts about how you prepped and whether you felt confident through the exam or in what areas you did or didn't? Elizabeth, talk to us a little bit about how you prepped, maybe how your clinical instructor encouraged you to prepare for the final exam, and then how are you feeling in that final itself?
Yeah. I mean, I think one thing that our cohort has done is kind of stayed in touch, like through the WhatsApp. So we kind of had this ongoing discussion group in that way. I think I had asked the group maybe for just some thoughts on like how they were organizing their studying. So that was helpful. And I reached out to Todd. So I had my clinical portion in New Jersey with Todd Edelson. And I had reached out to him and he confirmed. He said, yeah, this is a great strategy for you. And he actually gave me one piece of advice that I really did use this to prep for the exam. And he said, you need to just think of it as another learning opportunity. The examiners are not, they're not out there to really like trick you or see you make mistakes. And I would say that was really helpful going into it. And I think it was probably another huge learning opportunity for me, just the preparation and studying for the exam, which I wasn't really anticipating that. I felt like, okay, I've already taken in a lot of this information. I had the theoretical, the clinical, it's just about reorganizing it. But just the process for preparing, I think I learned even more that I wasn't anticipating.
And I guess all you guys were on that group. And so you're sharing cases, or are you guys identifying a study that you're reading and then saying, hey guys, have you read this study? Anybody want to chime in on that?
Yeah, no, I'll jump in. I think Ray and Chris were you guys, were the ones kind of just tossing out some good articles in there. I think Daniel threw in a few too. I might have tossed in a couple, but it's like anytime somebody would come across something and it's like, okay, hey, this might be interesting. They just went ahead and just shot that out. So again, real appreciative of the cohort we had, and they were real supportive. And that's the kind of kind of how that went along. And then we ended up kind of having like a little, side group just for the study session with just us four. And we kind of, bounced some things back and forth. But yeah. And I was just going to add on, I was like, from like the prepping aspect of it, I can't, thank Chris and Kim enough. I think the way they set up the clinical in Austin and, the times we had to, lunch breaks and go through some of the diploma manual stuff, I think they prepped us. Looking back at it, like, probably should have prepped a little bit better kind of going for those, but the notes and stuff we took, and it really did help out just to kind of condense and concise, the key aspects of potentially what would have been on the exam. So
Micah, you're talking about the weekly tutorials that were planned in each week and how you guys would sit with them, and Chris would rattle off like he's done it a million times, talking about safety. And,
oh man, yeah.
Gotcha. Okay, yeah, I thought that's what you were talking about. Ray, talk about your preparation and how you felt during the exam. Were there areas that you felt like, no, I did it about right, and other areas where you thought, I should have done this more?
Yeah, so definitely for the prep, sharing research I found very helpful. And in our little group, we did like some mock calls where we kind of did a mock oral exam with each other. That was also pretty helpful just to kind of ease the nerves and also identify gaps. Like, man, I ran out of talking space after 15 minutes. I'm supposed to talk for an hour. Wow.
Yes. Yeah. Yep. Daniel, compare your thoughts to what these guys have already said. Anything to add in terms of areas that you felt going into, perhaps that you were weak in, or other areas where you were strong in? Did you put more emphasis in preparing on the cases and the actual delivery of good quality MDT assessment, or was it more toward research and what supports or doesn't support the method?
Kind of trying to balance out everything. It was helpful kind of hearing everybody else's take and their approach. We kind of blended that thought process together. I guess at least looking at it somewhat strategically, it seemed like they had 6 questions and that, without divulging too much, just kind of looking at, all right, they can't expect us to know everything, and kind of treating them like human beings. And they're going to be understanding that we've dedicated at least a year or 3 years to doing this process. So we really want this. So kind of looking at it from that point, I try not to stress out, but tried to keep an even spread. I mean, it's always nice to go through the material and kind of reevaluate where I'm strong at or weak, but definitely it was a different experience and definitely a learning experience, kind of like what Elizabeth was saying, that they're asking you at such a high level just to kind of see where you're at. It's a good test of your abilities, but there's just so much material, it's hard to kind of gauge where you feel like you're at in this, like you're swimming across the Atlantic here. So you hope you're getting close, but I don't know 100%.
I had mentioned in a couple of episodes ago, Chris and Emily were on talking about their clinical residency in Austin, and Chris had kind of shared some contrasting ideas of different clinicians coming through and candidates having some strengths and weaknesses different. And I had originally gone through, and further back, I think, than you, Elizabeth, through my initial training. And so a lot of the other subgroups within other were not really identified and solidified way back then. Now, I've, of course, audited courses since then, but still, that wasn't an area where I had gotten it from the beginning. And so it was kind of a learning curve for me. So I felt like there was areas within other that I needed to really work on to prepare, and other areas where doing the podcast and all, I've talked to a lot of these instructors for a good while, and I felt pretty confident in some other areas in terms of utilizing the history to direct toward the physical exam and all. So were there any situations, and again, we've all committed to a confidentiality related to the exam, so we can't mention specifics for the sake of MII, but were there moments where you thought, yeah, I nailed that, and then maybe another that where you thought, oh, there's no way I passed? Daniel, any of that?
100%. Yeah. And then in my case, it took a little bit longer, and everybody was hearing their results. And then after Elizabeth got her results, I'm like, all right, great. I'm waiting for that email, and came around Thanksgiving that they sent me the email. The first day, second session felt pretty strong. It was more dealing with cervical, but that was the second day, first session. This first day, second session, and the last session, I just felt like a new baby, maybe part A. That's how it felt at some points.
Yeah.
But
Yeah. You guys, other guys, have any roller coaster feelings through the exams? Ray, yeah,
Yeah, for sure. I had an extremity case for one of them. I'm like, oh, I know extremities. I'm like, oh no, I guess I don't know extremities. I thought just from the setting up the physical exam, and I'm like, oh damn, I hope I passed that section.
Yeah. Yeah.
I remember after the first one, I think going back to the prep aspect too, it was like I knew my deficiency was more in kind of the 6 questions, some more of the research stuff. And I'm like, how are we going to remember all this stuff? And I remember getting in there and you feel like you answer a question, they see like when you answer, if you're not quite sure yourself, they really hammer that out. And then you're kind of like, oh gosh, did I get this right or did I get it wrong? But they're just making sure you're confident in your decision, stand your ground with it, give a little bit of backing on it. But I remember after the first exam, I remember calling Gary and I'm like, I think I bombed this thing, and then, he made a good point too. He had said something like, he's like, if you leave feeling like just really good, you probably messed something up. So, and they go in there and everybody's different level. And as smart as those guys and gals are, you feel like you're good. And they're going to like, all right, we're going to trip them up somehow, so you can expect something like that and just see how you respond. And they'll give you time if you need to kind of sit through and think through something. And they'll kind of, guide you a little bit, but yeah, they're gonna throw you some curveballs in there and make sure and really challenge you. Which, looking back at it, I really appreciate it. I wish we could, if there was a way to kind of, have a few more of those and just kind of get together and do that, that'd be great. But it was.
Maybe we could just ask Helen and Richard if they'll just look. Micah really wants to be tested about every 6 months, and he doesn't want to keep the diploma status.
Whatever it takes. Whatever. Yeah. That keeps me at the top of the game, and I'm all in.
Right. At any moment, if he doesn't pass, then he's out.
That's it. No more.
I'll start the email right now. No.
There you go. Yeah.
Elizabeth, did you have any kind of the roller coaster through the exam?
Yeah, I mean, I would say like, my first part of the exam, I thought, okay, whew, like that's done. But I'm like, okay, like I feel like I was solid. And then like the second and third, I was like, I don't even know what happened. Like I remember my husband came in for like maybe the last 10 minutes and he could kind of hear the conversation. And after he just looked at me and was like, are you okay? And I was like, like this, I'm good. It's just, I think like Micah was saying, the depth that you go leaves you kind of thinking, hey, like, could I have answered that a different way? Like how, like you just kind of question it. And then the last part of the exam, I was like, I feel really good about that. And then I even second guessed that, like, should I not feel good? So I think it was a roller coaster throughout the whole thing. Going into it, I feel like I knew that I had really studied at a intensity that, it was pretty hard. And I felt like there was no more I could have done going into this. So I am where I need to be and kind of thinking about what Todd had said, or I'm where I am and what I think I'll learn something from this. So.
Yeah. And Jason, I was going to add like the unknown of the format of the exam. That was, so I did, a Monday and a Wednesday. And after Monday, I was like, okay, now I know how to kind of what to expect, kind of on that second day. But the unknown of prepping for it drove me nuts, to be honest with you. I was like, I don't know how they're, like I said, you can, on certain topics, you can talk for like an hour on it. I'm like, well, what do they want from this? Right. And, but yeah, it definitely felt better after the first day. Jason, what about you? How'd you feel on it?
Yeah, I was just thinking I was telling somebody like the Thursday evening I finished up and I think I did all right. This I could have done better here. And sure, yep. The one examiner asked me this question and I just had to say, I'm sorry, I just don't know, But then by Friday, I'm like, well, there was that thing too. And then this thing. And then by Saturday. And by Sunday, I was thinking, there's no way I passed this thing. Yeah, it's guaranteed that I didn't pass it. So, because then I was also thinking about, I think, Micah, you had learned about 4 or 5 days after your exam, the last year exam, that you had passed. And so I'm watching each day go by and thinking, oh, no. I hadn't heard back. So, yeah, it's a little nerve-wracking. But Well, great. I appreciate you guys kind of walking us through how it went. Now that you're through, you diplomats, tell us a little bit about where you're hoping to take this. What have you learned through the whole process? Let's start with that first. What have you learned just going through the whole process that maybe you thought differently about going into it? You thought you may take this out of the diploma program, but now that you look back, maybe it's something different. Is there a contrast to what you thought versus what in reality you look back and you see that you really gained from it?
Yeah, I thought I was going to learn Robin's secret techniques. I thought, I was going to Texas with Chris, Chase, and Kim, and that, they had some hidden knowledge that's not in the text that Robin passed down and through the ages or something. But it wasn't about some magical hands-on technique. No, it was just really sharpening that clinical reasoning and getting good with the differential diagnosis of, hey, is it true derangement? Is it MUR? Is it a ANR? Whatever. And then really getting through that history and physical exam, like, oh, and even prepping for the exam, for the examination, even with the other in serious pathology, I'm like, oh, there's some questions I should be asking, like red flag screening. I'm like, oh, there's some things I didn't even think about there.
Yeah. Yeah. Anyone else?
I thought there'd be like a secret handshake or something, No, but I mean, I think going through the process, really kind of just fully just taking an unbiased approach to, evaluation and just let the system guide you. I mean, I look back at before I went through the program and when, you get that certification and, you're like, all right, I feel like I'm on top of the game there. But just looking back and realizing that, I was trying to pigeonhole a lot of people down that derangement. Everybody wants to be down that one, but just sitting back and listening and asking the right questions and then truly just, telling the patient, hey, your symptoms, your mechanics guides us, right? So it's kind of really, just falling into that, I guess.
Elizabeth, were you going to say something?
Yeah, it makes me think of in your cohort saying that, diplomats, they can fix anybody. And I was like, so thinking, yeah, I would love to be that person, right? That is not who I am now as a diplomat, but I am so grateful for the opportunity that I've had and how far I've taken it to this level, because I really feel the most confident I've felt in my career in terms of assessing patients and using clinical reasoning skills. And just like maybe Ray and Micah alluded to, like, there's not like this magic technique or this magic handshake that we learn, but it's learning how to reason and assess every patient. And I feel like I'm still practicing that, right? Like, so I'm still learning and I'm still using that, but I feel like there's been a significant amount of change in the way I practice since doing this. Yes.
Yeah. Excellent. Thanks for mentioning that, Elizabeth. And I think that any diplomat who's been out there 5, 10, 20 years are going to tell us that, hey, look, there's plenty to still grow. This is not an end point here, but a career-long effort here. So, yeah. So, but I think you're spot on. Yeah. And I think that the more we hear these senior faculty and people just talk, it really is about that confidence of saying, look, I can put that to rest now. I don't have to keep going back to that and wondering, did I miss a directional preference? This patient is telling me by their history, they're showing me by their response, then I can let that be, and I don't have to keep chasing that. Whereas when the history says, no, I'm staying right here, and I'm going to dig a little harder because there should be a directional preference here because we hear this, and this, and this. So the confidence, I think, is huge. And we hear that often from our instructors as well. So talk to us a little bit about where you guys are. I think, Elizabeth, you've already been that mentor. You are that mentor to Emily. You've prompted her. You've taken a woman with 3 small children and convinced her to go through the diploma program right when her kids are small. So good on you for that. But and we hear from people like Chris Chase, who mentioned that the people who are really set up for success to go through the diploma program and then take the torch are those who want to really mentor other clinicians in their respective clinics or wherever they are. So where do you guys see yourself going? What do you want to do with this now that you're through? What's in the future? Ray?
Yeah, so I'm still practicing at a hospital outpatient, and there's like 30 clinicians that I practice with, but I'm like the only McKenzie certified and now diplomat McKenzie clinician there. So there's some people taking Part A and Part Bs and stuff, but I do see myself kind of being more in a mentor role to now these new clinicians who maybe want to pursue a cert and help them out.
Mm-hmm. Good. Micah?
Yeah, so I just look back to like same thing. You always want to try to give back. And I remember distinctly, like within the first, 5 or 6 months of me practicing, I remember, kind of fumbling through with some patients. And then I look over there and I see Gary just, smiling, nodding, having a good conversation. And he walks off and I was like, Gary, how's this person doing? Oh, she's good. He's good. And then we got to talk and he asked me a question. He's like, do you ever stay up at night kind of thinking about, did I do the right thing? Did I give that person the right exercise? And I just remember thinking, oh yeah, all the time. I don't think I've gotten this. Then I kind of paused for a minute, and then I kind of turned back to him, like, what about you? And he goes, nope, don't think about it. And then that's just the confidence that, trusting the system, knowing the system. And then hopefully, if we have some therapists under me and then, I can kind of, have that same, try to pass the torch or light it and kind of help somebody else down the road with that. The other part too is trying to get, anything I can do to help out to kind of get MDT more like known to like
dry needling.
Do I?
Like dry needling.
Yeah, well, that's what I was going to say. So I got a text from one of our, referral physicians, and he's an ENT guy, and he was like, "Hey, do you? I got a person in here with some neck tightness, pain, and all that." So I'm sitting there thinking, I'm reading it, I'm like, "Oh yeah, finally, I can get him hooked on." And then he asked, like, "Do y'all do dry needling?" And I talked to Gary about that. I sent him a message. I was like, it's kind of sad sometimes that physicians know more about dry needling than they do MDT. So trying to help, try to gently guide and kind of, get more understanding to some of the physicians and the stigmatism behind, MDT is not just extension based, right? But yeah, trying to maybe hopefully change the world with that, right?
Yeah. Daniel, you were going to mention in your clinic any ideas and hopes, aspirations going forward?
I've had a few co-workers where they'll send a patient to me and maybe they're sick or something, fill in just to see them, and they'll have a directional preference, give it to them, and they'll go back to their primary clinician and they're like, how, what's going on? How does he do this? Everybody gets better. And so it's trying to get them to see maybe there's a classification system for them. I've seen them where they'll watch me and they're kind of saying, all right, why is he doing that? What's going on? And there's a few of them that are doing kind of a test retest. And so it's spurring a little bit, but I haven't, I'm just amazed at how much free time I have right now. It's nice to have this done. I hope to grow upon it. It'd be interesting to do an actual some sort of journals, science test, something or other to kind of help further, but I have no plans at this moment.
Yeah. So in your setting, Daniel, you've got other clinicians who maybe aren't seeing as much.
Kind of like Ray.
What's that?
Kind of like Ray in that sense, where I'm the only one that really does MDT.
Yeah.
They may have heard about it in school. We have other satellite clinics that there's a therapist that messaged me and said, hey, you got your DPT, how was it? And I've been looking at this for a while, and she was asking questions, but
yeah. Have you been discussed with the director of the PT department about opportunities that, hey, you can share a bit of what you learned, or that's not really anything offered?
I could reach out to him, but it's kind of like what Mike is finding. It's like, that's great. Here's a patient, be a PT and see them, but that's about it. They don't really put too much weight on it. But, maybe that's a part where we can do a better job and like sit down and explain it, or to have at least some sort of discussion.
Yeah.
But nothing set yet, so to speak.
Not yet. Okay. We had talked with several in my cohort through the previous episodes that kind of took us through the theoretical and some of the clinical, and just heard some of the candidates going through kind of highs and lows of, wow, I'm glad I did this, or this is not what I thought it was going to be. And I'm concerned, is this all worth it? Or is it worth the time? Is it worth the cost? Is it worth disrupting and pulling myself out of the clinic for this long? Did you guys have any of those thoughts through your theoretical, through the clinical? And then retrospectively, have you looked back and thought, okay, I've come to this conclusion about it, whether it was or wasn't worth all the time, effort, and money? Ray?
Yeah, I definitely had some doubts financially, and man, I had to go travel out to Texas from New York City, take my time away from the clinic, even my private practice. But at the end of the day, I thought, hey, it was a good experience, just the whole diploma program overall. And, it's made me a better clinician. And who knows, maybe I'll go pursue research. I saw that, still a gap in, research for MDT with cervical spine or in extremity cases. I have a case report that I'm going to be doing a poster at the APTA CSM in 2024 on an elbow derangement that was mimicking cubital tunnel syndrome. But just little things like that, like, there's more gaps in the research that also need to be addressed as well.
Yeah, excellent, Micah.
Yeah. Yeah, I mean, cost and time away from, friends and family is tough. We do this, to better ourselves and better our patients, right? So, the unfortunate thing is did I get a pay bump after this? No, right? Did my reimbursement rate get more? No. But, I know just from a standpoint of where I'm at and again, getting my patients better and giving them the right treatment, whether it's I can help them out or get them to the right person or professional, that's self-gratifying, so looking back to, was it worth it? Heck yeah. I would do it again in a heartbeat. Being in Austin was, it was a stressful time, but it was some of the most fun I've had in a while, kind of experiencing that. Daniel made it, I was very fortunate to have him there with me. We had a great time, but yeah, it was a struggle. It was tough. And it's, looking back at it, you appreciate the process, right? The studying leading up to it, looking back, there's a method to the madness of, going through such these broad topics and trying to pick apart certain, pieces of literature. And, and again, it came out better after. So yeah, absolutely.
Elizabeth?
Yeah, so I'm like, thank you for asking this question, because I was shaking my head when you were saying it. Did I ever doubt it? And I'm saying, but I was like, I never doubted that I was becoming a better clinician during this whole process. But as a mom, I doubted whether I should be like leaving my children for 9 weeks, right? As a therapist who's been practicing for several years, I questioned, like, should I be needing this at this point in my career? And I feel like I guess those left because I felt like it was such an amazing opportunity. Again, I've grown so much as a clinician that my only regret was probably not doing this. Yeah, I am glad that I've done it when I've done it.
Yeah. No, I can appreciate what you're saying, Elizabeth, because I'm thinking, okay, I'm not as young as, Daniel and Chris Boyer and these guys, and how much longer am I going to be doing this, and how much impact can I make? And gosh, if I had just done this when I was in my 20s or something, but things happen the way they happen, and you just got to look at, there must be a reason for this or whatever, just where you are in your walk career. I appreciate, what you mentioned too, Micah, that about just at the end of the day, it should be about just doing the best that you can and becoming better for the sake of becoming better, rather than looking for, necessarily a pay increase or reimbursement improvement or whatever. Daniel, your thoughts?
I think the whole course, it was insurance on preventing burnout. I think just being more efficient. I don't think the volume is going to get any less, and being able to manage and confidently educate people. And I think having more tools to be able to confidently educate patients is helpful. Every time I walked away from a course, I remember C&D, it was a vacation. It was so much fun to hear Scott talk, and I looked forward to doing this for quite some time, but that time away in Austin, that was always a big hurdle. But I think doing 10 weeks straight is probably the best way to do it. You get immersed and you don't disrupt it, and you learn quite a bit. So
Jason, I'll add too, and another thing too is nobody can take education away from you, right? So, and I had a wise guy told me one time, it was like, if it was easy, everybody would do it, So just, enjoy the process and be thankful you're able to come out on the other side, I guess.
Yeah. Well, we can say that right now, especially since we all got through it and passed it. But well, congratulations, every one of you.
Yeah.
I'm happy that you guys did well. I'm sort of happy that I did well as well. I'll have to admit. But I appreciate you guys being able to share a little bit of your thoughts about the exam, and appreciate you guys joining me on the podcast.
Thanks.
Thank you.
Okay, so there you go with episode 401. A collective sigh of relief from the five of us. It is clear that from early on, they let everyone know that not everyone passes the final exam, but it was nice to have a small celebration for these colleagues, of course. Special thanks to Elizabeth and Micah, Daniel, and Ray back with us for this post-exam discussion. Stay tuned for the next episode with the podcast as we discuss the community, opportunities and benefits of attaining the designation of the MDT diploma. That coming up soon. Hey, and don't forget to subscribe to my email updates to be notified of new episodes. You can do so by clicking on the sign-up bar at the top of my website. That's mechanicalcareforum.com. Subscribe to the podcast on your favorite podcast player and follow me on my social media channels, as we'll be notifying you when each episode comes out. If you're hearing this audio version, do know that we are releasing video versions of the podcast on our YouTube channel as well. Again, we want to thank today's sponsor, the McKenzie Institute International, providing worldwide training and support to clinicians in the principles and practice of the McKenzie method for the management of patients with spinal and extremity disorders. The McKenzie Institute Diploma program provides the highest level of MDT training. It enables clinicians to acquire an in-depth understanding of the McKenzie method and become experts in its effective use in guiding their patients to achieve their personal goals. If you have an interest in learning more about the diploma program, check it out at McKenzieInstitute.org. And if you've heard enough and you're ready to, you can apply to enroll in this program through McKenzieInstitute.org through October 31st of each year. And by the way, if you're wishing you had more interaction with skilled and like-minded clinicians and researchers, we're continuing to plug away here at the Mechanical Care Forum with new cases within Case Conversations, our patient case discussion resource, and with new scientific studies within Inside the Science, our peer-reviewed summary and discussion resource. Access to past, current, and newly added cases in scientific studies to assist you in having practice-impacting content for those who want to continue to go the extra mile to become better. These resources, Case Conversations, and Inside the Science are intended to provide virtual mentoring for you and help keep you moving forward in your professional development. You can check these out at mechanicalcareforum.com. All right, I wish you a great week with your patients this week. A good reminder to celebrate your successes. And join us right back here next week for more of Season 13 and more of Sharing Experience for Improved Patient Care.